Yes, friends, please give me a thumbs up if I'm both visible and audible. Am I audible? Yes, please, anyone just give me confirmation. So, today we are going to discuss the sexually transmitted disease, which is very important topic in all the exams. So, but many questions were asked in FMG exam. So, I just wanted to give a quick overview of this particular topic. With the help of few mnemonics, also you can probably easily remember the causative agents and the clinical features of various types of genital ulcer disease, mainly which is going to be our today's discussion topic. Yes, so myself, I am Dr. Maddineni Srinivas, your dermatology educator on Unacademy platform. I have done my MBBS from Siddhartha Medical College, diploma from JSS Mysore, and secondary DNB from Hindu Rao Hospital, Delhi. So, if you are not yet following me on Unacademy, you can follow me to get latest updates on the video notifications on your mobile. Okay, and I request all of you not to use. So, on your mobile, if at all there are Facebook or Instagram, I would suggest you to just uh, uninstall these social media apps, because they are going to uh, definitely they are going to cause lot of problems with your attention span, because whenever you get a notification, you will get a feeling that yes, you should check what is that notification, so it will distract your studies. So I would suggest you to uninstall Facebook and Instagram. These are a no apps in your mobile. Okay, so in this particular video we are going to discuss mainly the ulcers topic and also urethritis, and few details about the syndromic management. So that is going to be our today's topic of discussion. And in the discharge we are going to discuss the urethritis mainly. Urethritis and the other vaginal discharge, they are going to be taken care of in your OBG. So I would not go into details, but we will see this under the syndromic management in kit 2. Okay, in kit 2 we'll discuss what are the different kinds of vaginal discharge, and this words I have previously discussed it on YouTube. You can check that video out. You just have to type in WATS and DRMST, you will get the video link. So shall we start, friends? Everyone ready? Please give me a thumbs up, whoever is watching. So we shall start with the urethritis topic. Yes, Dr. Rogin Pavi, good evening, very good evening. Yes, so I can see only one thumbs up coming up. So please, everyone, whoever is live, I can see some 10 students live. So please give me a thumbs up. Yes. So welcome, Dr. Sagar Dhiman. So briefly, we'll see urethritis. What are the types and how can you differentiate between the two types of the urethritis? So the two broad varieties of urethral discharge which can be seen are, one is gonococcal urethritis, one is gonococcal urethritis, and the second one is called non-gonococcal urethritis. And basically here there are many organisms in non-gonococcal type of urethritis, but the most common among all of them, most common is equal to chlamydia trachomatis. Chlamydia trachomatis. Please remember this very important point. Chlamydia trachomatis, it is the most common one. So there are certain differences between gonococcal urethritis and non-gonococcal urethritis, both in the clinical features and also in the incubation period and also in the investigations and in the treatment part. So we'll see each and every one of them. So here, of course, the causative agent is Neisseria gonorrhea. Neisseria gonorrhea. Neisseria gonococcus. It is going to cause, of course, from the name itself you can say it is gonorrhea. Okay, so now we will look at both of them as a comparison. Why? Because if you read them as separate entities, then every possibility is there, you will forget them. So if you read them as a comparison, then you will remember very easily. Why? Because both of them have almost contrasting features. Like for example, gonococcal urethritis. In gonococcal urethritis, there will be a lot of constitutional symptoms. That is, the patient is going to have severe fever. The patient is going to have fever, arthritis. There will be arthritis, arthralgia, myalgia. So apart from this, what is the very important symptom is there will be excessive dysuria. There will be dysuria which will be present in the patient. That is, during the micturition, patient is going to have excessive pain during micturition. Pain during micturition is a very characteristic symptom which patient is going to complain to. Pain during micturition. Okay, so this is very important complaint. And if you look at the incubation period is also very important. It will help you to differentiate between gonococcal and non-gonococcal urethritis. In the gonococcal urethritis, the incubation period is very short, ranging from just 2 to 5 days. Okay, you can tell it as within 1 week, less than 1 week. Whereas in non-gonococcal urethritis, we will see what will be the features. So not only Chlamydia trachomatis, which is the most common organism causing non-gonococcal urethritis, we are having a bunch of other organisms which can also cause this particular condition. They are ureaplasma, Urealyticum, Trichomonas vaginalis and Mycoplasma genitalis. So these are the other organisms which can cause non-gonococcal urethritis, and here incubation period will be 1 to 2 weeks, that is 7 to 14 days. 7 to 14 days. You can say gonococcal urethritis is having a very short incubation period. And one more feature which will be clinically noted is in gonococcal type of urethritis, we are going to have purulent discharge, and that is what is meaning of purulent. It is going to be pus filled. It is going to be pus filled, and there will be excessive discharge, excessive amount of this purulent discharge coming out of the urethra. Whereas in non-gonococcal type of urethritis, the discharge is going to be very scanty. It is going to be very scanty, that is very little in amount, and it is going to be mainly serous or mucus in nature, but not frank pus like. That is, there will not be purulent discharge, but it will be just serous or mucus type of discharge. Okay, and if you try to investigate the person of gonococcal urethritis, because it is caused by Neisseria, gonorrhea, so what are the investigations of choice? Yes, if you are thinking that it is gram stain, you are right. We will do a gram stain here, and this will appear gram negative. This will appear as gram negative diplococci in the neutrophils. Okay, this is very important to be remembered. In the neutrophils, we can see this gram negative diplococci, which will be present. I will show you in the next slide. There is a picture. Okay, so if you want to do culture, culture medium which is used here will be, that is to diagnose gonococcal kind of urethritis, it is Thayer-Martin medium. And before putting into this culture medium, we should use some kind of transport medium. So the transport medium which is used here is Stewart's medium. So this is the transport medium, Stewart's medium. Okay, all of these are very important both from microbiology and also dermatology point of view. Okay, and coming to the non-gonococcal type of urethritis, because most common causative agent is Chlamydia trachomatis, and please remember in Chlamydia trachomatis also the strains which are responsible for causing urethritis are D2K. So this is also very important. And here investigation which is used will be nucleic acid amplification test. Nucleic acid amplification test. Nucleic acid amplification test. It is called as NAAT, nucleic acid amplification test. So what are the very important points which we have seen till now? So there will be severe dysuria, pain will be there during maturation, and here incubation period is very short, 2 to 5 days. Whereas here it is 7 to 14 days. So that is the difference, and here of course the causative agent will be Neisseria gonococcus. Okay. Yes. Now, can anyone tell comment in the comment section? So what is this which type of urethritis this could most probably be? Is it gonococcal or is it non-gonococcal? So anyone? Yes. Yes, Dr. Fly High, Arun, Dr. Khan, Dr. Rogin Pavi, Dr. Sagar, anyone. So what this could be, what you are able to see, it is a frank pus, that is, it is a purulent discharge. It is a purulent discharge. So what this could be? Yes, Fly High and Sagar, please remember this is a gonococcal. This is a gonococcal urethritis. Gonococcal type of urethritis is the one which is going to present with frank pus coming out of the urethral orifice. Okay, please remember. Whereas in the case of non-gonococcal urethritis, it is going to be serous or mucus type of discharge which is going to be coming out, and it is also going to be very scanty in nature. Yes, now this is showing the gram stain. This is showing the gram stain, and here you are able to see this gram stain picture where gram negative diplococci are present intracellularly as well as extracellularly. Now, can anyone tell me what is the organism which is causing the urethritis here? So this is a patient in whom urethral discharge was there, and it was gram stain, and we are able to see this gram negative diplococci. Yes, can anyone tell me? If you are thinking it is Neisseria gonorrhea, then you are right. If you are thinking it is Neisseria gonorrhea, you are right. Okay. Yes, very good. So this was in fact a question which was asked in this INACT. Okay. So in the treatment part, all you need to remember is for gonococcal urethritis, the drug of choice which is used is third generation cephalosporins, and among them in the injectable we prefer injection ceftriaxone 250 mg IM, or we prefer tablet cefixime 400 mg stat. Okay, so these are the treatments, and in the non-gonococcal urethritis, what is the drug of choice which is preferred is tablet azithromycin 1 gram. Tablet azithromycin 1 gram. Okay, so this is the treatment which we are using. So now we will move on to the ulcers. Now we will move on to the ulcers. In the ulcers, we should know these very important disease conditions. They are syphilis, chancroid, and the next one is LGV, that is lymphogranuloma venereum, and the other one is donovanosis. So we are going to discuss about these ulcerative conditions now. Yes, now we will look at the chancre, that is the ulcer, genital ulcer, which is seen in the case of syphilis. And this particular, there are in the syphilis, you should remember that there are different stages, and the ulcerative stage of the syphilis, it is called as a primary syphilis. Okay, and the ulcer which is caused by this primary syphilis, it is called as a chancre. It is having one more name. Depending upon the ulcer consistency on palpation, it is given a name called as hard chancre. Okay, it is also called as hard chancre. The causative agent is Treponema pallidum. The incubation period, IP stands for incubation period, it is around 9 to 90 days. And average you can take it as 21 days, that is almost 3 weeks. So this is the average incubation period of this Treponema pallidum. And if you look at the syphilitic ulcer, that is chancre, it is defined as a single ulcer which is painless ulcer. So here you are able to see this single ulcer which is going to be painless. The patient will not have any pain because of the ulcer, and it is indurated ulcer. That is, if you wear a glove and try to examine the patient, this ulcer is going to be very, very hard. So because of this, it is also called as button like induration. So this is how it is described as if you touch your button, how hard it will be. So similar consistency will be there. So it is called as button like induration. So this is one more point. So, and the base is, if you look at this base, the base is going to be very, very clean, very, very clean base. And if you try to gently press the lesion, there will not be any bleeding which can be seen. So it will not bleed on touch, does not bleed on touch. So all these characteristics of the ulcer are very, very important to be remembered. Single, painless, indurated ulcer, clean base, and does not bleed on touch. Okay. So now we will look at the lymph node and its features. So you should remember that in sexually transmitted disease, always ulcer and lymph node characteristics are very, very important for you to come to a conclusive diagnosis. So ulcer characteristics we have already seen. So now we will look at the lymph node. The lymph node is painless and bilaterally enlarged. Bilaterally enlarged, painless lymph nodes will be there. And if you observe carefully, in the case of this syphilis, in case of syphilitic ulcer, lymph nodes are painless and also ulcers are painless. So how can you remember this? How can you remember this? So you can easily remember with the help of this small trick. The name of the disease is syphi. So you will not remember it as syphilis, you will remember it as syphilis. So if you remember the name of the disease as syphilis, then you can easily remember that both ulcer and also lymphadenopathy will be painless. Okay, I hope this is helpful. Please understand this very, very important difference between both of them. Okay, now coming to the management. So in the management, we should diagnose this condition first. So what is the from your micro knowledge, I hope all of you know the investigation of choice in primary syphilis is dark ground microscopy. So dark ground illumination, where we can see this spirochetes, that is Treponema pallidum movements in the dark ground microscope. Okay, so once we have diagnosed it, the next step is treatment. So in the treatment, the drug of choice is benzathine penicillin 2.4 million international units, which will be given into each of the buttocks as IM, as 1.2 into each of the buttocks. Okay, and please remember, this should be done only after allergy testing. This should be done after allergy testing, because there can be persons who can be penicillin sensitive. Allergy testing should be done. Okay, now we will look at the chancroid. So before explaining you about the chancroid, I want all of you to just remember, instead of the actual spelling is chancroid, but I want all of you to remember it as chancroid. So why am I telling you this? I will tell you while explaining the treatment part. Okay, so it is chancroid. And what is the causative agent of this chancroid? So if you remember it as Haemophilus ducreyi, then yes, you remember it right. So it is Haemophilus ducreyi, and in this particular name of the disease only, you have a very, very important mnemonic: Haemophilus ducreyi. So if you remember the organism's name as Haemophilus ducreyi, what is the significance? What is that which you are going to gain is, you will remember that both lymphadenopathy and both ulcer, both of them are going to be painful here. Both of the ulcer and also the lymphadenopathy are painful here. So painful. And the next part I will show you, yes, this particular lymphadenopathy is also tender That is painful. Okay, please remember, you can remember that ulcer and lymphadenopathy both are painful with the help of this very useful mnemonic. So this chancroid, it is having few characteristics which are exactly opposite to that of syphilis. So if you remember, that is the reason why I am explaining syphilis and chancroid both side by side. So this chancroid, unlike syphilis, it is going to have multiple soft ulcers which will easily bleed on touch and which are extremely painful, and they have a necrotic base. So these points, all of these points are exactly opposite to that of syphilis. And because here the ulcers are going to feel very soft, so these are the ulcers, multiple ulcers which you are able to see, these multiple ulcers, these will be soft on touch, because of which they are called as soft, they are given a name called as soft chancre. So in syphilis we call the chancre as hard chancre, and here in chancroid we call these ulcers as soft chancres. And if you look at the incubation period is also very opposite to that of syphilis. Here it is going to be 2 to 5 days. So it is very short incubation period. So in the lymph nodes there is one characteristic called as bubo. Bubo is present. So please remember, bubo are present in two conditions. One is chancroid and the other one is LGV. LGV we'll discuss in the next slide. Okay, and in the investigation, so what could be the investigation which can be used here? So yes, it is gram staining. If you thought it is gram staining, you are right, and there is very peculiar appearance which is seen on this gram stain of this Haemophilus ducreyi organisms, and this was in fact a question which was asked in the FMGE. Okay, this is very important, and the name of the appearance, it is called as rail. One second. There is small glitch. Okay. So sorry for the small interruption, there was some small glitch. Okay, so yes, what we are talking, yes, this particular Haemophilus ducreyi, if you do a gram stain, then we are going to get this railroad track or school of fish appearance, where these gram negative cocobacilli, they will appear as if they are following each other. That is the reason why we have given this name called as school of fish appearance. So this is very important to be remembered in the case of Haemophilus ducreyi in chancroid. And why did I tell you to remember this as chancroid? Chancroid is because of this particular reason. So if you just remember, you already remember Haemophilus ducreyi. So cry is the word which you remembered already. And why is what is the importance of this cry is because you can remember that it is both lymph nodes and also this ulcer, both of them are painful. Okay, that is the importance of knowing this. Yes, and yeah, in the treatment part, what is the drug of choice? It is macrolides. It is azithromycin. So you can remember that with the help of this mnemonic, chancroid. So macrolide. So it is azithromycin. I have seen few students who do forget what are the drugs of choice. So with the help of this, you can remember that it is azithromycin, which is the drug of choice. Now coming to the lymphogranuloma venereum. Lymphogranuloma venereum, it is caused by Chlamydia trachomatis. It is caused by Chlamydia trachomatis, and here the incubation period, it is going to be, yes, can anyone tell me what is the incubation period of lymphogranuloma venereum? It is very easy to remember. There are three letters. So it will be 3 to 30 days. 3 to 30 days is the range. And also in the Chlamydia trachomatis organism, there are various strains which are going to cause LGV, and they are L1, L2 and L3, and I want all of you to remember that L2 is the most common type of Chlamydia trachomatis which is going to cause this LGV. L2 is the most common cause. And here ulcer is going to be single and painless. Ulcer is going to be single and painless, whereas lymph node will be painful, that is tenderness will be present. And here, as I have already told, we see chancroid and LGV to cause buboes. So here there will be bubo. LGV stands for lymphogranuloma venereum. Lymphogranuloma venereum. Okay. So here please remember, in syphilis both of ulcer and lymph nodes were painless, whereas in chancroid both ulcer and lymph node were painful. Here what will happen, ulcer will be painless, whereas the lymph node will be painful. So how can you remember? This is actually out of these four genital ulcer diseases, syphilis, chancroid, LGV and donovanosis, this LGV is going to have a very transient ulcer. Very transient ulcer. In fact, the patient will oftentimes miss the ulcer and directly he will come to you. For example, you become a dermatologist in future, he will directly come to you with the complaints of this painful lymphadenopathy. So you can remember the ulcer is very transient and it is very painless. It is not even observed by the patient himself. And in this particular condition, groove sign will be present. Groove sign is going to be positive, and genitalial disfigurement is going to be seen. And in the males, this genital disfigurement, it is given a name called saxophone ramrod or ramhorn penis. So saxophone ramrod penis. And in the females, this particular disfigurement, it is called as estheomen. And this is the saxophone penis. And this is called as estheomen. And this particular disfigurement is being caused because the lymphatics are damaged. And you can see the name of the condition itself is lymphogranuloma venereum. Okay. And what is this particular groove sign is? So if you look at a person, at the inguinal lymph nodes above, inguinal lymph nodes above and below, there will be lymphadenopathy. Here inguinal lymph nodes, and here femoral lymph nodes will be there. So this is the inguinal ligament. Because of this enlargement on either side of the inguinal ligament, there will be a groove which will be seen between these lymph nodes, and this is called as a groove sign. Groove sign is positive in lymphogranuloma venereum. Okay. Yes. So how can you remember all these features of lymphogranuloma venereum? Very easily, with the help of this person, RGV. So I hope everyone knows this particular person who is there on this picture, Ram Gopal Verma. So just remember RGV if you want to remember all the features of LGV. So how can you remember? So this person is very fond of media attention, always controversies. So the name of the organism which is causing this condition is Chlamydia trachomatis. So that thing you can remember. And the next one is groove sign. So if you look at YouTube videos of this particular person, so always he will be featuring in the YouTube videos where he will be getting this particular groove music and this thug life videos. So you can remember that LGV has this groove music always going on. So it is groove sign is positive. So groove sign is positive, that you can remember, groove sign positive in LGV. And during this thing, when Modi asked to just diya jalao, this person fired his cigarette, and he told that he will support all the doctors, frontline warriors this way. So you can remember this very important test called Fry test, which is the intradermal test of historical importance, but of course for the exam and questions this is still very important. So Fry test, so this person is firing this cigarette, you can remember it as Fry. So now you can remember this Fry test. And finally, what is the drug of choice? So how can you remember the drug of choice? So for one of the pictures promotions, this particular person, he used as bicycle, he used this rickshaw, this tricycle, so to make the promotion. So the drug of choice for this LGV is doxycycline. So all these can be remembered with the help of this particular person RGV. Okay, I hope it is clear. And this is the mnemonic, if there are any mnemonic fans. So LGV, in LGV, lymphogranuloma venereum, we are going to see asymptomatic ulcer, and there will be a bubo which will be unilateral bubo, and it is chlamydia trachomatis which is the cause here, L1, L2, L3. Doxycycline is the drug of choice. Esthamine is going to be there, which is strictures and elephantiasis of the vulva. Fry test will be positive, groove sign will be positive. So A, B, C, D, E, F, G, A, B, C, D, E, F, G is the mnemonic for any mnemonic fans. Now coming to the donovenosis, donovenosis is also called as granuloma inguinal. It is also called as granuloma venereum. It is also called as granuloma venereum. So you might be wondering, so LGV was having lymphogranuloma venereum and this donovenosis is just having granuloma venereum. So why is it so? Why is it so? Because there is a reason. It is so because here in donovenosis, no lymphadenopathy will be there. No lymphadenopathy will be there. No lymphadenopathy is there in this donovenosis. That is the reason why the name is not having any L in its name. So no lymphogranuloma in the name of this particular disease. So what is the causative agent? Causative agent here is Klebsiella granulomatis or Kellimatobacterium granulomatis. It is also called as Kellimatobacterium granulomatis. Kellimatobacterium granulomatis. Okay, and here the incubation period is 8 to 80 days. So it is 8 to 80 days, and here the ulcer is going to have very peculiar feature. It is a single ulcer usually, which will be very beefy red in appearance and exuberant granulomatous and extremely bleedy. It will bleed on touch. It will bleed on touch. It will bleed on touch. Bleeds very easily on touch. So if you wear a glove and try to palpate this, it will bleed on touch. So here you are able to see this single exuberant beefy red granulomatous ulcer, which will easily bleed on touch if you try to palpate it. And if you want to diagnose this condition, so in the investigation what we will do, we will just crush a part of the edge of the ulcer and we will make a crushed smear, and we are going to stain it with the help of a Giemsa stain, right Giemsa stain. So if you do a right Giemsa stain, what you will observe is, we will observe Donovan bodies. So what are these? These are basically, we are going to see macrophages. Macrophages will be having these bipolar stained organisms, bipolar stained organisms. So these are given the name Donovan bodies. Please remember, Donovan bodies are not seen. Donovan bodies are not seen in Leishmania donovani. Not seen in Leishmania donovani. Not seen in Leishmania donovani. So not seen in leishmaniasis. This is very important point. This is very important point. And please remember, this particular bipolar staining is given a different name. It is also called as safety pin appearance. It is also called as safety pin appearance. Safety pin appearance, and this safety pin appearance is not only seen in this Calimotobacterium granulomatis, it is also seen in the case of Yersinia pestis. It is also seen in the case of Yersinia pestis. So both of them will show the safety pin appearance. Here you are able to see, if you zoom this, you can observe that this is having this bipolar staining which can be seen, and this is going to appear as if it's a safety pin. So can anyone tell me what is the disease caused by Yersinia pestis? So question to everyone. So there are 25 live students. So can anyone tell me what is the disease caused by Yersinia pestis? Yes. So in the treatment of this particular donovanosis, the drug of choice is azithromycin, 1 gram per week. It should be given for at least 3 weeks or till the time the ulcer is going to heal. So yes, anyone can tell me what is the disease caused by Yersinia pestis? Yes. Yes, very good, Naveen Tiwari, you are right. It is plague. Right. So in the herpes, we will just see very few points about this. So you should remember that this herpes is this herpes is going to be caused by HSV2, herpes simplex virus type 2, and this is given a name. It is called as herpes genitalis. And the incubation period here will be 3 to 12 days. It is going to be 3 to 12 days, and the description of the lesions will be multiple tender, very painful grouped erosions and ulcers will be there, and these ulcers coalesce with each other to form polycyclic type of lesions. So initially there will be vesicles. And these vesicles, they rupture and they do form erosions, and ultimately they will form this polycyclic shaped ulcers. Okay. And lymph nodes, in the case of herpes, there will be bilaterally painful ulcers, and here please remember there will not be any bubo. This is very important point. No bubo will be seen in this case. And while discussing donovanosis, so I just did not told you, so there is no lymphadenopathy, but over the inguinal area we can see subcutaneous nodules, and these subcutaneous nodules, they are given a name called as pseudobubo. And they are subcutaneous nodules. They are not actual enlargement of the inguinal lymph nodes or femoral lymph nodes. They are just a subcutaneous collection of these Calimotobacterium granulomatous which are going. That is the reason why these are called as pseudobubo. Okay. Yes, in the Zang smear of herpes genitalis, what can we see in the Zang smear of herpes genitalis? We can see multinucleated giant cells and acantholytic cells. So both of these can be seen. This was the INI-CET question. So please remember this very important point. We can see both acantholytic cells and also multinucleated giant cells. And in the treatment of herpes, we are going to use Kit 5, where we will give this oral acyclovir 400 mg TID for 7 days. So all these are given here. So it is genital ulcer disease because of herpes. So treatment will be acyclovir 400 mg thrice daily for 7 days. And this we have already discussed, right? So syphilis is going to have stages. So in the secondary syphilis, we are going to see very important cutaneous and also mucus and also involvement of the hair. So how does this secondary syphilis come to the patient? Because in the primary syphilis, the ulcer is having the organism Treponema pallidum, and this will go through the blood. So hematogenously it will spread and it will deposit in the skin, hair and mucosa, because of which there is going to be constitutional symptoms and generalized lymphadenopathy will be there. But please remember the most characteristic lymph node which is enlarged and it should be examined is epitrochlear lymph node. So you can see this is the site where this lymph node is present, and this should be always palpated if you suspect a person to have secondary syphilis. And please remember, secondary syphilis is also called as a great imitator. This disease is also called as a great imitator. Why? Because the clinical manifestations of this condition are going to be very varied, And in fact, all types of cutaneous lesions can be seen in this particular secondary syphilis except for vesiculobullous lesions. Except for vesiculobullous lesions, all the types of lesions can be there. Vesiculobullous lesions will not be there, but all the other possible lesions can be there. That is the reason why the rash of this secondary syphilis is called as polymorphic rash. And out of that, the most important rash is syphilids. So these are basically hyperpigmented macules, which can be seen over the palms and soles. So these are called as syphilids, and these are very, very characteristic. Why? Because if you try to apply pressure with the help of a alpin, with the blunt end of the alpin, if you try to apply pressure, then there is going to be a deep dermal tenderness can be elicited. And this is called as BO sign. What does BO stand for? Buschke-Ollendorff sign. This is positive in the case of secondary syphilis. And there are some mucus changes which can be seen. And they are condyloma acuminata. Condyloma lata. Can be seen in the case of secondary syphilis. This is one important feature, and the other one is snail track ulcers. Can be seen in the mucosa. This is oral mucosa. Snail track ulcers can be seen. And over the scalp we can see moth-eaten alopecia. These are very, very important secondary syphilitic changes. And in the tertiary syphilis, you need to remember few points. These were not asked for FMG. This is also called as benign tertiary syphilis, and they are given a name called as gammas, and these are ulcers with punched out edges. On the surface we can see wash leather slough can be seen, and the consistency of this is rubbery, and it is called as rubbery nodule. And in the tertiary phase, they are going to be systemic manifestations like cardiovascular system and central nervous system involvement, where you can remember the cardiovascular system features in the form of this letter A. There will be aneurysms, and most common one will be seen in the ascending aorta, and there will be aortic regurgitation. And in the central nervous system, you can remember this letter G, general paresis of insane, and there will be gait abnormalities. Tapes dorsalis will be the manifestation. And in the case of this tertiary syphilis, the investigation of choice is CSF-VDRL. CSF-VDRL is the investigation of choice. So can anyone tell me which one of these is the symbol for Suraksha Clinic? Yes, anyone? Yes, I can see many online. So can anyone tell me what is the name of what? Can you name which one is the logo used for Suraksha Clinic? Yes. So I think I am coming in between. So yes, I can see. Okay, so only Dr. Fly High was right. Okay, so please remember option D. This is the symbol for Suraksha Clinic. Okay, option D is the answer. Option D. So if you so the last with this we will just finish this session. So another 5 minutes. So the kits. So in the kits you should remember the order of these kit, and you can remember that with the help of this very good what you can say a story mnemonic. So please remember the numbers and the colors of the kits are important to be remembered. Gray girl wearing bracelet, reading yellow book. So with the help of this, you can remember kit 1 is gray in color, kit 2 is green in color, kit 3 is white in color, kit 4 is blue, kit 5 is red, kit 6 is yellow, and kit 7 is black in color. So you can remember with help of this the colors and the numbers. And kit 1, it is basically used for urethral discharge, anorectal discharge, and cervicitis syndromes. And we should focus on gonococcal and non-gonococcal cause for urethritis. So to combat gonococcal urethritis, we have cefixime 400 mg single dose, and to combat the non-gonococcal causes, we have azithromycin 1 gram single dose. Okay. And this green kit, it is basically, it will be discussed in the gynae, obs gynae. So it is to combat candidiasis, trichomoniasis, and also bacterial vaginosis. So to deal with candidiasis, we have fluconazole 150 mg candida, and to combat trichomonas and also bacterial vaginosis. So we have secnidazole 1 gram BD. So that is 2 grams dose of secnidazole is there. So in the case of syphilitic and chancroidal ulcers, we have this blue and also white kits. In the white kit, we have benzathine penicillin to kill the Treponema pallidum and azithromycin to take care of the Haemophilus ducrei. Yes, if at all the patient is allergic to penicillin, then we'll replace the benzathine penicillin with doxycycline, and this azithromycin will take care of the chancroid, that is Haemophilus ducrei. And this will be discussed in detail in your obs gynae because it is basically used in pelvic inflammatory disease. So you can remember lower abdominal pain, it is yellow kit, and with the mnemonic you can remember yellow is the kit 6. Okay. So in the treatment of buboes, we have this kit 7, which is black in color. To combat LGV, we have doxycycline, and to deal with chancroid, we have azithromycin 1 gram single dose. Okay, so this is taken from the website, so you can see that the number here is given wrong. It is kit 7, which is black in color. Okay, and now just as a I just want all of you to participate and tell me and fill me, help me to fill up these blanks. Okay, so this will call A, this will call as B, this will call it as C, this will call it as D, and this will call it as E. So can anyone tell me, a patient is having single painless ulcer which are bilaterally with bilaterally painless lymph nodes. So what is the answer here? So what is A? So yes, can anyone tell me what is the genital ulcer disease which should be filled up in the A? Okay, Dr. Sagar, you are right. A is syphilis. Yes, can anyone tell me what is the option B, where we are seeing single painless ulcer but there are painful buboes? Painful buboes are there. So yes, anyone? So tell me what is the answer for B. What should I fill up in the B? Yes, Dr. Sagar, Naveen, so I can see 25, 26 students watching the live session. So yes, anyone help me to fill up the B? So Sandeep says chancroid. So does anyone agree with him? Okay, please, yes, whoever told it is LGV, you are right. Please remember B is LGV. Why? Because please remember in chancroid, Sandeep, in chancroid we have seen both ulcer and also lymph node are painful. But here I am telling that this patient is having single painless ulcer, but lymph nodes are painful and bubo is there. Okay. That is why I told bubo can be seen both in LGV and chancroid. So here it is LGV. And can anyone tell me here what is C, which is having single painless ulcer and there is no lymphadenopathy? That is, you can say pseudo bubo is there here. Pseudo bubo is there. So no lymphadenopathy is there. Now can anyone tell me where pseudobubo is there? So what should I fill up in the C? What should I fill up in the C? Yes, anyone? Yes, very good. Donovanosis. You are right, it is donovanosis. Okay, very good. So now please help me to fill up this. Multiple painful ulcers are there. Multiple painful ulcers are there. And if you examine the lymph nodes, you have seen that painful lymph nodes are there. And bubo is also there. Bubo is also there. So what is D? So bubo is also there. Multiple painful ulcers are there and lymph nodes are also painful. Yes, yes, Dr. Sagar, you are right. You are right. Shankroid. Very good. Shankroid. Yes, everyone very good. Dr. Naveen Sandeep, you are right. All are right. Yes. So what is this last one which is remaining, where we get to see multiple painful ulcers and we will see lymph nodes also which are painful, but we will not see any bubo. There will not be any suppuration. So what is this E? What is this E here? So at the last, I think I am coming in the way. In the last thing we have multiple painful ulcers and lymph nodes are showing painful lymphadenopathy, but there are no buboes. So yes, can anyone tell me what is E? So the other ulcer condition, what is remaining? So only two conditions. So please remember in this we are going to have herpes. We are going to have herpes. Okay. So please remember, in chancroid and in herpes, in both of them we can see multiple painful ulcers. Multiple painful ulcers are present in both chancroid and also herpes. So if you look at the lymph nodes, even lymph nodes are going to be painful in both of them. Painful in both of them. Painful in both of them, but in chancroid we will have a bubo. Whereas in herpes we don't see any bubo. Okay, this is very important difference which all of you should know. Okay, we don't get to see bubo in herpes. So the last one is herpes. Okay. So that's it, guys. So if you enjoyed this session and if you want this particular particular presentation as a soft copy, so do join my group. The name of the Telegram group is Crack Derma with DRMST. Crack Derma with DRMST. So my Telegram group name is Crack Derma with DRMST. CRACK Derma with DRMSD. So you just search the Telegram. In the Telegram you search with this, fill this up, Crack Derma with DRMSD, or just write DRMSD in the Telegram search option. You will get my channel and also my group. So you can join that. Daily I am posting important questions and daily I am conducting quizzes. So today's our quiz topic in the Telegram group at 9:30 is genodermatosis. So join the group, participate in the quizzes. So I'm even planning to make every day 15-20 minutes question discussion. So because in Telegram, whatever questions I'm asking, so those questions I'm planning to make a discussion session, just 15-20 minutes every day. Every day one subtopic, and over a span of 10 to 15 days we'll complete one revision cycle of all the important dermatological uh, uh, topics whichever are extremely important. So one among them is sexually transmitted disease. So this I have covered as a theory part. So in the daily sessions I am planning to make every day MCQ discussion, so that you will understand how to approach MCQs, which is very important. So reading theory is like net practice. So ultimately you should practice MCQs, which is the real test, or one day which you are going to play, that is the exam, in the exam. Okay, so in the Unacademy there are many batches which are starting, so you can join them. You can join these batches if your target is next 2022 or INSET, and for that matter FMGE June. So there are various batches which are starting every month. These batches are starting, and this particular batch I am going to take up the classes of dermatology. It has started already in December. It has started. So it's basically a evening batch where you will get to watch the videos from 3 to 5, 5:30 to 7:30, and 8 to 10. Okay, so these are the sessions. So yes, now just and if you are not yet following me on Unacademy, you can follow me. My profile name is Srinivas Kumar Maddineni. The link will be there in the description below. So you can join that with the help of that, and you can get all the updates of the notifications of the videos which I'm posting every day. I'm planning to make videos. Okay, so please join me on Unacademy. We will make sure that you will come out with flying colors, because MCQ discussion is very important, apart from just reading and mugging up the theory. So I would suggest you, if you are not yet downloaded this Unacademy, download this, practice these quizzes which are happening every day at 8 o'clock for NEET PG 2021, at 9 o'clock for NEET PG 2022. And if you like this concept of Unacademy offline and also recorded versions of the courses, so I would suggest you to take up this plus subscription, where you will get daily live classes. Structured courses are there, so every month courses are there, unlimited access is there. You can watch how many number of hours you want, both live and also recorded sessions, and live tests and quizzes are there. So if your target is FMG, I would suggest you to opt for the 3 months subscription, where you will get a off if you use this particular referral code DRMST. So you can get this for 3 months, 11,250, and unlimited access for all the quizzes, offline courses, recorded courses, everything whichever is there on the Unacademy platform. And if your target is NEET next 2022, then I would suggest you to just look into this iconic subscription, where both Unacademy and also Prep Ladder can be accessed. So Prep Ladder has this question bank and the video lectures which are there. So both of them can be accessed from Unacademy. So here the minimum duration is 12 months, and again if you use the DRMSD as the code, you are going to get 10% off. Okay. So if your target is next 2022, I would suggest to use this particular subscription, which is iconic subscription, and this is a referral code DRMST. And this is the particular another batch which is going to start from 27th January 2021. And all the details I'm keeping up here in, you can take a screenshot, or you can download the PDF. I will post it on my Telegram group tonight. Okay, you can download this, and you can also revise whatever genital ulcer disease were discussed in this today's class, and also urethritis. And these are all the faculty whoever is going to take the classes, so everything is fixed. So you are going to get live experience from the comfort of your home. This is very important. You need not go to any place to take the classes. So there will be unlimited access to the course, and top educators are going to teach you, and all your doubts will be clarified. Doubt clearing sessions also will be there, and you can download all the subjects whichever will be discussed as a PDF formats. Okay. And that's it in this session, guys. So I thank you so much for all your patient listening. This is Dr. Maddineni Srinivas signing off. If you are having any doubts, queries, comments, feedback, so please feel free to drop your messages in the comment section. So I will go through the comments. So just mention me as hashtag DRMSD. You just have to mention me as hashtag DRMSD and write whatever query you have. I will follow this particular post of this YouTube and I will try to answer your queries, and you can join my Telegram group, Crack Dharma with DRMSD. Crack Dharma with DRMSD. You can join that. Okay, so that's it in this session, guys. So I thank you so much for all your patient listening. Bye bye. Happy learning dermatology, and please use sanitization, mask, and social distancing. Okay, happy learning dermatology. Bye bye. And if you like this session, please do give a thumbs up, please do give a like, and also please do subscribe to this Unacademy YouTube channel, so that you can get all the latest updates, and also tell your friends, close friends, and whoever study group is there with you, so that all of them get advantage. And please remember, studying and discussing as a group, studying and discussing as a groups is very important. Discussions are very important for getting a very good rank. Please remember, you may think that by discussing your knowledge will be transferred to other person, but please remember, by discussions what will happen, it is not going to just add on, it will multiply your knowledge. Okay, so I hope you all know this concept of synergism. So here that is going to apply, and you are going to become very much you will become a gyani if you start discussions, and discussions will be the one which will fetch you a very good rank. So please make a 2 to 3 person a small discussion group and do discussions every day on a daily basis. Okay, this is very important. Discussions are very important. So form a small study group, okay. Ideally, if everyone is using the same platform for your preparation, that would be fantastic. So that you can keep on discussing whatever doubts you're having from all the subjects of that particular platform. Okay, and I would recommend you to take up some online platform, because going to offline classes is not a feasible thing nowadays. Okay, so that's it, guys. So bye bye.